Time for another politics video, and it's 27th of June 25, it's Saturday, and I just heard in the Daily Mail or something that in NHS England, Wes Streeting, the Health Secretary, will be introducing patient feedback surveys. And I think these are going to be sort of targeted a month later or whatever. But in my opinion, surveys should be everywhere in the public sector, in politics. Surveys, polls, especially now that we can do them by phone, instant feedback. So it's 77 years too late in my opinion. It should have had this in 1948 when the NHS was founded, and it's not enough because, in my opinion, all public sector interactions should have the option of QR code feedback. You know, you get each incident or whatever interaction gets a QR code if you want, I suppose, or they probably generate one anyway, but yeah, and then the person can comment on the interaction via the internet, via their phone or whatever, you know, using the QR code. You can do a 5-star rating, add a comment as well. You've always got to have the option of comments. So people will know that I've been going on about this. So let's look at Google Gemini to see what they say about it. This is my first look at this. It's the Google Gemini 2.5 flash version. So this is the quick version, which takes 5 seconds or whatever. As to tell me about Wes Streeting introducing patient feedback surveys, because I'm a big fan of surveys. It's in the news today. Wes Streeting, the UK Health Secretary, has recently announced significant changes to the NHS with a strong emphasis on patient feedback and utilising technology to improve healthcare. This is part of a broader 10-year plan for the NHS. Yeah, because they're saying, I mean, to me, it might look as if he's a genius or something, but really, patient feedbacks, I think that's basic. You know, any sensible health secretary should be announcing that sort of fact. He might get a knighthood for all this, you know. I don't agree with getting knighthoods and stuff, but, you know, as if he's some sort of a genius, you know, but actually it's very, very basic what he's doing, you know. It's a basic requirement of any health system, I think. And so probably this will happen. Then the NHS will act as if it was always like that, even though for 78 years it's not been like that. You know, and it should be right across the whole public sector, especially things like the police, where you should also have the right to record any interaction. That's either record it yourself or they're going to put you in handcuffs or whatever. They record it and give you a copy, you know, because obviously if you're in handcuffs, you're going to have a bit of a problem. Filming. Yeah, so here's a breakdown of the key elements. NHS App Overhaul. I mean, this is really obvious. A major focus is on upgrading the NHS app. This will include, see, the thing about governments and public sectors, they were always too late to the apps, you know, or to the internet even. You know, if you compare them to, say, banks had their banking apps up, say 2002 or whatever, you know. Governments, for some reason, always seem to be behind the curve 10, 20 years. It really is a joke. 20 years, actually, I would say. Up in Scotland, we still don't have a universal NHS app. We've got about 14 different health boards, and they've all got different apps. You know, it's a complete mess. From private companies as well. Absolute joke. At least down in the NHS England, they've got the one app. This will include new features like My Choices. This is the app they're talking about. This feature will allow patients to access info on various healthcare providers, including data on waiting times, patient outcomes, and patient satisfaction scores. Yep, totally agree with it. This aims to empower patients to choose where they receive treatment based on their preferences. I agree with that as well. We shouldn't be stuck with our own GP surgery. You should at least be able to choose anywhere. You should be able to choose any doctor in your own area, say. You shouldn't have to be stuck with a surgery, I don't think. Maybe it's a bit difficult than I'm thinking, but yeah, it shouldn't be the doctor's surgery that controls everything. You know, this is the problem. It's public are meant to be grateful for what they receive rather than they're there to serve the public. It's the other way around. It's ended up, especially now, you can't even get an appointment without speaking to someone. You'll probably be a phone appointment, which is okay, but a lot of them could be online. I would argue, they should be online. At least you could still have face-to-face online. Yeah, that sort of thing. Yeah, anyway, let's see what they're saying. My Companion AI feature. This AI-powered tool will give patients direct access to trusted health information, helping them articulate their health needs, preferences and questions during consultations. Yep, fantastic. It's all pretty obvious. Nobody should get a knighthood for something like that. Any health secretary should come up with that. I mean, AI, you could say it's only really taking off now, maybe even in the last year or two. Maybe we should have been using it 3 or 4 years ago. But yeah, at least they're getting on the AI bus pretty soon. So that's pretty good. Although it's all obvious stuff. Linking funding to feedback. Yeah, there are reports suggesting that a part of the new proposals will involve contacting patients a few weeks after their hospital treatment for feedback. Yeah. Based on their responses, money could potentially be diverted to a local improvement fund, especially in areas with a poor record of care. This suggests a direct link between patient satisfaction and hospital funding. I think you've always also got to look at it at who the person is as well, because there's a lot of people in the NHS probably need to go, basically, you shouldn't think of it as failure, even though I suppose it is. You should just think that it's just not right. They're just not right for it. We're not there to keep them in a job. It's the other way around. You've got to be there to get good. I mean, and especially all these cases where there's things, not really nice things going on. Quite often it can take years for somebody to finally blow the whistle on this type of person. So yeah, you've got to have all of that. Yeah. So I've said before that I think it should be, especially public sector, it should be survey feedbacks all the time, recording as well maybe. But then also, because when you think of the private sector, you've got things like how's my driving on vans, call this number. You've got, even if you get internet cable installed, quite a lot of them ask you to phone somebody to see how they got on. I'm not really happy about it actually. I mean, personally I use mobile now and I don't need to worry about interaction with people really at all, which is great. I remember I had one internet cable hanging where the guy, you could smell alcohol off his breath. I think it was from the night before, but and then he was quite rude actually, and then there was another one it was BT. I just couldn't get. The guy said put a note through and saying he missed you, but I don't think he even chapped the door. And then I've even had somebody with BT, the line went down, and whoever it was, I think it was around about Christmas or something, that they connected the phone line to another phone line, so it wasn't even that person's phone line. They literally had somebody else's phone number, or somebody else's connection, even though it was their phone number. It was somebody else's connection or something like that. It was really stupid. I just can't believe the sort of things going up. So thank goodness I'm with mobile now. I don't need to worry about that ever again, that sort of craziness. So anyway, back onto this. Publicly available feedback. Patient scores and comments submitted through the NHS app will be made publicly available. Yeah, I agree with that. I don't know about comments, because people can be mean, because you've got these sites where you're meant to learn about companies, but I think it's only people that have some sort of problem or whatever, or some sort of gripe, that do it, because everybody else is happy, don't bother. Even Amazon comments are just totally useless, I think. It's not really a good way of doing things, but it's better than nothing. But so yeah, I do agree. Transparency is intended to help officials identify poorly performing providers and allow patients to make informed choices about where to seek treatment. Yeah, so yeah, I do agree with that in general, though. Like I say, there is a big risk. Simplifying regulation. Streeting is also streamlining NHS regulation, including the scrapping of several patient and professional watchdogs like Healthwatch, Brighton and Hove. The idea is to have more doers and fewer checkers, with patients encouraged to submit reviews through the NHS app to flag emerging issues. Yeah, absolutely. These quangos, I was sort of in favour of quangos, I thought, oh, that's a good idea, wise people. But I can see now a lot of times I think they've been total disasters, really. I mean, the woke thing was really all quango stuff, really. Um, and also, there's been talk that, say in Scotland, we could have a citizens' parliament to go with our real parliament. And then they ask questions like, do you think they should be able to veto parliament or have a big say? And I said no in that, because I do YouGov, because like I say, I believe we should be able to do polls, because polls, you could say it's the nearest to democracy we've got. People would say, no, we've got elections. Well, we've only got elections every 5 years, and then you're voting for a party hamper. You're not really getting a choice at all. It should be direct democracy. We should be voting on issues, on single issues, like referendums all the time, like in Switzerland. So, yeah. What else is it saying? The Care Quality Commission will take responsibility for overseeing safety. Democratising healthcare. Streeting's overarching goal is to democratise healthcare, giving all patients, regardless of their background, access to information about their conditions and procedures. He stated that the current system often favours wealthier patients with better access to information. Yeah, I totally agree, because they probably just go private, and that's what I would do with the money. I mean, two important things I think we should have is, one is we should have the right to vitamin and mineral testing, and if they don't want to give us it, then we should be allowed to easily do it privately. There should be a test centre somewhere, and we should be able to do that privately. Everyone should know their own health, vitamin and mineral status, in my opinion. So things like that. You should also be able to access tests directly, like gut tests, SIBO tests, small intestine bacterial overgrowth tests. If you want people to take care of their own health, they need to have access to tests. At the moment, we've not got access to tests easily. So all this stuff he's doing, people say he's a genius and he deserves a knighthood, but I would say this is very basic, obvious stuff, So out of the current Labour thing, I think Keir's going to get the boot from his own side, basically. Whereas Wes Streeting will probably get a knighthood and stuff, Maybe he'll become the Labour leader, These changes are presented as a way to hold providers accountable, drive improvements and give patients more agency in their healthcare journey. However, some concerns have been raised, particularly by the NHS Confederation. This is what I would expect, quangos, about the potential for providers to be unfairly penalised for systemic issues beyond their control if funding is too directly linked to individual patient feedback without careful design. Because we tried the quango thing. I think it was John Major who brought them in, and we've had them for like 30 years. It was meant to be the wise people giving advice, but we can see that they're absolutely woke, crazy, and it's got daft, really. Really, it's been daft. Okay, I'm going to look at the research thing, but it's far too long. So this is what the Google research one looks like. It's like 10 pages long. It's like a dissertation. So I've just been talking for about 15 minutes and I didn't have it switched on, so I don't feel like going through it again, but I'll just go through that list because that sort of summarises my mindset. I mean, this is like a university dissertation, So here's what they're planning, really. Wes Streeting's proposed patient feedback system mechanism. Patient contact a few weeks post-hospital treatment for feedback. I think it should be instant for everyone. Funding link. Hospital funding tied to patient ratings. 10% of standard payment rates diverted if feedback is negative. Fund destination. Diverted money goes to a local improvement fund for the underperforming service. Targeted implementation. Initially piloted in services with a poor record of care, expanded nationwide later. Incentive focus aims to create a powerful incentive for services to improve patient experience. No direct staff bonuses. Yeah, no staff bonuses. NHS App integration. My choice is featured to display patient satisfaction scores, waiting times and outcomes for provider comparison. Digital empowerment, part of a broader strategy to give patients choices and control and democratise healthcare via technology. I like lists, polls, I'm not a big fan of text like this. I mean, you need it, but I prefer just lists and graphs, you know. So this is just to show you how it went from the 2000s to present, and it never worked apparently, so they think. Early 2000s, mid 2010. So this is over Blair, Brown, Cameron. I don't blame them for trying this, don't I? The key, what it tried for, the national initiatives on dignity, respect, patient involvement, large-scale patient surveys established. I'm a big fan of surveys, surveys polls. It's more important than your vote because we're not got a very democratic vote. We get to vote for a party hamper every 5 years. That's not very democratic. If you're going to keep that system, at least make it every 3 years like Australia, New Zealand. But I believe in direct democracy, voting on issues, referendums. The Swiss electoral system's the nearest to that. Yeah, the focus was to centralise patient voice, measure experiences, identify areas for improvement. The outcomes, initial progress, but inquiries amid staff's inquiry revealed persistent patient exclusion. So the Smith staffs, I can't remember, was this to do with babies dying in the incubation ward or that sort of thing, something like that, I think it was. And like I say, once I do an inquiry, they'd say it ended up a shambles, probably. Quite often the will's not there, especially the people who are being judged. 2008, Lord Darcy's High Quality Care for All report. So this would have been under Blair. Focus, elevated patient experience to equal footing with safety and effectiveness. Outcome, theoretical shift, but practical implementation challenges remained. Then in 2009 we had the NHS Constitution first published. This would have been under, well, maybe Brown, but possibly still Blair. Outlined rights for patients and the public. Established legal and ethical framework for patient rights. 2014, this would have been under Cameron. NHS England, the 5-year forward view. So they tried to do a 5-year plan. Dedicated chapter to a new relationship with patients and communities. Continued policy emphasis, but increasing system pressures began to erode progress. Yeah, just sort of withered on the vine, really, probably. 2000 star ratings. So this is what I said basically. We should have star ratings for every public sector thing. Have a QR code for every interaction. Introduction of star ratings for hospital performance. And the idea was to drive transparency, accountability and improvement through competition. And the outcome, they think, criticised for demoralising staff, focus on non-clinical metrics, waiting times, finance, that's fair enough, over clinical quality, potential for perverse incentives, e.g. mid-staffs. Yeah, this is something went on there, they had a big inquiry, I can't remember what it was. And they probably found that this made it worse. And I've no doubt it did, because the staff probably panicked about it and everything, current existing surveys, GP patient surveys, CQCs, secondary care surveys, cancer patient experience survey, voices, proms, friend and family test, and the idea is to assess patient experience across various services, monitor trends, inform local improvements. And what it says, downside, the lack of standardised approaches for translating data into large-scale improvement, little or no impact, yep, at strategic level, declining public satisfaction despite surveys, yep. I mean, a lot of surveys, even in YouGov, I feel they're trying to put you in one direction, or they just ask you questions that you're not interested in, or the answer you want to give, you can't really give it, So in all these things you need to have a comment section so that people can say what they want to say, And in recent years, declining patient involvement in decisions, staff feel powerless to act on feedback, yep. Attributed to increasing system pressures, staff shortages, industrial action and institutional defensiveness. Yeah, because the problem is, I think a lot of these people hired there, they're expecting to have a job for life, but really, if you're not up to it, you need to go, really, you know. That might be your attitude, it might be inappropriate stuff, it might be, you know, all sorts of stuff. And I can see this being a real big problem. I can see one big problem arising, you know, out of that. You know, so here's another table. I like tables. Summary of stakeholder reaction to patient feedback proposals. Sir Jim Mackay, critical of existing NHS mechanism for public engagement. Fair enough. Even though he's probably part of the problem as well, maybe. I don't know, actually. British Medical Association, yeah, they'll be against it, I would imagine. Scepticism regarding government ability to meet targets. Public lacks confidence in cutting waiting times. Calls for real reform and value in staff, not just press releases, etc. Yep. Yeah, I'd imagine them all. Royal College of GPs to be against it. You know. Supports review of GP funding formula to address inequalities. Yeah, blah 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 blah. Bereaved patients, I think they'll be in favour of it. Health Watch, England, yeah, I think. Yeah. Anyway, you've got to do it. Anyway, keep going. And like I say, we should have more. I think a lot of people should be using private thingy in because their attitude's the other way around. And a lot of times it's the same doctors. It'll be NHS doctors, you know, because a lot of time they do late afternoon work in the private sector, even though they're NHS doctors, etc., you know, and they moan about not having time. I mean, NHS hospitals should be doing scans, etc., 24/7, really, if things there. We should be able to see a doctor at a hospital, a GP appointment. We should be able to do any test we want if we want to pay for it at a local scanning centre or whatever. All this, yeah. So this looks really interesting, you know. Yeah, this table's a bit too long for reading here. Okay, it researched 73 websites. It's just to show you what you can do with Google Gemini in a moment. X has got Grok AI, and you've got ChatGPT and that. But yeah, okay, bye bye.